Okay, so we're looking at his hair, and his hair is brown with some gray, with equal distribution. His skin is intact, it's warm, it's dry, he's got good skin turgor, good mobility. The next thing that we're going to look at is we're going to inspect a mole. I'm going to look for a mole. And we have one. Not on this arm. Oh, we get a mole here. Okay, so it's light brown with slightly irregular edges. It looks about even. I would get my measuring scale and measure it. Measuring scale and measure it, and it's about 2 centimeters, a little less, about 1.8, and it's slightly raised. It's not bumpy, it's pretty smooth. It has hair growing on the edges but not out of the center, and I would ask if there's any tenderness or if you've noticed any changes in the mole.
No.
Recently? Okay. The next thing I would do is observe the symmetry of his face. So we got symmetrical. His palpebral fissures are even. I would have him smile. And he's got equal symmetry in his face, and nasal labial folds are symmetrical. The next thing I would do is have him clench his jaw. Now open, close, side to side. Some minor clicking when he's moving it side to side. Okay. Minor clicking at the TMJ when he's moving his chin side to side. He has +5 strength in his jaw. He has full range of motion, and like I said, some minor clicking with opening and closing. So then I would have him, next I would be assessing his eyes. I would, they're in equal position. They match up along the top of his ear, so they're in proper alignment. I would have him clench his eyes closed, and don't let me open them. Good. I'm going to have you raise your eyebrows. And that tests for cranial nerve 7 and 11. I would have you puff out your cheeks. Smile. Good. And I would also have him stick his tongue out. Okay, good. So facial features are symmetrical. I'd have him look straight so I can check pupillary reflexes. Look straight as I... Oh, my flashlight is dying. There we go. Okay. His pupils are equal and reactive with a brisk response. His iris is brown, it's round and circular, and his pupils react to light directly and consensually, which checks on the cranial nerve 3. His sclera is white, slight redness in the corner, but on both eyes, but for the most part it's white, clear and intact. We're going to pull down his lid, and his conjunctiva is pink and moist. I would put on gloves to palpate his lacrimal duct in the corner of his eye to check to see if there's any discharge. What else? So, any tenderness, swelling, or anything around your eyes?
No.
No. Okay. I'm going to follow. Okay. So follow my finger. Okay. So his eyes conjugate, and I would do the confrontation test, which checks cranial nerve 2. I would cover one eye and tell me when you see my finger. So cover one eye. And tell me when you see my Tell me when you look straight.
Oh,
Tell me when you see my finger.
see it,
Okay. Good. Then we would do it with the other eye. Tell me when you see my finger.
see it.
Okay. So, his peripheral vision is intact. Extraocular movement test would be the following: is the figure with his eyes. So follow my finger. Good. And his extraocular eye movement is intact. He's got that also checks the cardinal field of gaze. He has parallel tracking, no nystagmus, with extraocular movements are intact. The next I would do is to assess his ears, and I would palpate the outer ear. Don't notice any issues, any pain or tenderness with your ears?
No,
Okay. I would push in on the tragus. And then I